Go.
So my name is Matan Setton. I'm a pediatric cardiologist at Columbia and Morgan Stanley Children's Hospital.
Awesome. What did you think of when you were asked to come to Nigeria to do a open heart medical mission?
Honestly, I didn't know what really to expect. I previously hadn't had much interest in doing medical mission trips. When Dr. Goldstone asked me if I'd be interested to go, I was excited for the opportunity to work with him, and also excited for the opportunity to provide service to the people in Nigeria. We had heard that there had not been any pediatric heart surgery in Nigeria since prior to the start of the COVID-19 pandemic. And so I was eager to provide a service, but really without any sense of expectation of what practicing medicine in Nigeria would be like.
What do you think of the facility here at the Damarin Okosa Memorial Hospital?
The facility itself is fantastic. I think many of us have commented that the equipment really is state of the art and the best that is available. But at the same time, I think there are challenges with the resources that are available that make practicing medicine, particularly as it pertains to congenital heart disease and pediatric heart surgery, challenging. And I think it has forced our team to improvise and at times sort of innovate to find ways to overcome the resource shortages, while at the same time providing the high level of care that each of us seek to provide.
What has been the biggest challenges for you as a cardiologist during this trip?
Yeah, undoubtedly it has been discussing with families whether or not we would be able to offer them surgery. I think we came with a mindset of doing X number of cases and doing them safely and ensuring that we had good outcomes and that we wouldn't push the boundaries of the team's capabilities, because the goals of the trip were really to establish a foundation and infrastructure for future trips. I think we ended up seeing more patients than I think I or other team members anticipated we would. And once we meet patients and we know that they may be good candidates for surgery, I think each of us wants to really find a way to provide that for them, knowing that we may be the child's only opportunity, that the child may or may not survive until the next time we're back. It's not even a certainty that we would be back. So in a sense, we feel that we've been forced to ration medical care, but with tremendous implications and sometimes life altering. I mean, that's best exemplified by the night prior to the departure of most of our team. We discussed amongst ourselves whether or not we would operate on a 4-month-old child with tetralogy of Fallot in the middle of the night, because the child had such severe right ventricular outflow tract obstruction that it was sort of a foregone conclusion that the child would not survive much longer. And it was really quite remarkable to see team members willing to push themselves to the absolute limit of their capabilities in an attempt to be able to provide this service. Ultimately, we decided that it simply logistically could not be done, and we ended up having to tell that family initially that we would not be able to provide surgery. Although I'm really quite satisfied and happy to say that we were subsequently able to have the mom come back with the baby, and that surgery has since been completed, even after the departure of most of our team from the United States. But it's once we meet these children, they're no longer patients, they're no longer surgical cases. It only takes spending a little bit of time with a child and their family, seeing the desperation, the lengths that these families are willing to go to want to bend every which way to be able to take care of their children. And it's really been, I think, quite difficult for a lot of us, for those families that we've had to say no to. Whether it's no because we simply did not think that the surgery that was required was something that could be safely done in Nigeria at this point in time, or we didn't have the materials to provide that surgery in the case of children who needed RVPA conduits, or simply having to choose that we thought other children had more urgent needs.
VOOM is about selfless sacrifice, and you're kind of the leader of trying to get people to stay a little bit longer and change their flights so that they could do more surgery. Is there anything in particular with any of the families or anything with your experience here that really stands out in your mind, like a family or a story or anything where, that is so different here than it is like in the U.S.?
Well, I think the main difference here is we are seeing the natural evolution of congenital heart disease to an extent that we don't see in the United States. In the United States, each of these patients would have been intervened on long before they're presenting to us. And here we're really seeing individuals with such advanced disease that they're really quite symptomatic and quite limited in their day-to-day activities.
Thank you for coming. We appreciate it. You've done a fabulous job.
It's been a pleasure to be here, and I look forward to the opportunity to return.
You're awesome. Thanks.